There is a chemical in our body called insulin, which is produced by the liver. This insulin serves as a key that unlocks the cells and the tissue for sugar to be able to enter to generate energy and control the blood sugar. But in diabetes mellitus, this chemical might not be produced at all, or in some cases it might be produced but not sufficient to meet up the level of the sugar in the blood, or in some cases it might be produced sufficiently but the tissue and the cells may be resistant to this insulin. That is, they refuse to open for sugar to enter. Due to many causes that I've mentioned in my previous video, which now gives rise to accumulation of sugar in the blood called hyperglycemia and other signs and symptoms of diabetes mellitus. The good news is that this disease is manageable, but early and prompt treatment is very essential to prevent complications that can arise from diabetes mellitus. Hello viewers, welcome back to my channel Ask Your Nurse. If you are seeing my video for the first time, I'm Ashamoluwasho. I'm a registered nurse. Thanks for stopping by. This channel focuses on content related to health. Do well to subscribe to my channel, like, and hit the notification bell below to be the first person to know the next time I upload another new video. And to my returning subscribers, thank you guys for always being there. There are three major approaches to treat diabetes mellitus, and the first one is through dietary and lifestyle modification. The second one is through the use of oral hypoglycemic drugs, that is medication that lowers blood sugar, which is taken orally. And the third one is through the use of insulin. Also, the treatment of diabetes mellitus is determined by the type of diabetes mellitus you're having, either type 1, where there is little or no insulin at all, and it usually occurs suddenly and it is common in childhood and adolescence, or type 2, where there is insufficient insulin production or there is resistance to insulin produced, and this usually occur in adults from 40 years and above, or obese children. Now let's start with type 1 diabetes mellitus. Type 1 diabetes mellitus is treated with the use of insulin injection. This insulin injection is an artificial insulin that is produced artificially, but the action is similar to that of insulin that is produced in the body naturally. When this insulin injection is taken, it goes through the blood to unlock the cells and the tissue, to open them for sugar to be able to enter to generate energy and then regulate the blood sugar. This insulin is taken several times during the day for survival. You need to take it every day. If you have type 1 diabetes, your healthcare professionals are going to teach you how to give this insulin just under your skin. But when you are giving this injection insulin, ensure you give it at different sites. Rotate the sites where you give it. When you give it at the abdomen, you can give it at the thigh. The next time, you'll be rotating the sites where you give it to prevent localized tissue damage and absorption problems. Also, in type 1 diabetes mellitus, you should ensure you pay close attention to your sugar level. You measure it from time to time to prevent hypoglycemia. And this insulin injection is usually calculated based on your carbohydrate intake and your physical activity. That is how they calculate the amount of insulin you'll be taking each time. Avoid frequent eating, avoid carbohydrate diet. As I've said, that your carbohydrate diet will be calculated. You should eat whole grains like brown rice, like oats, like legumes, for example beans and bean products like bean soup, bean cake, moi moi, and so on like that. Then you can take fruits moderately. Avoid sugary fruits like pineapple. You can take non-starchy vegetables too. Exercise also helps to control sugar, but avoid vigorous exercise if you have type 1 diabetes, because it might crash down your sugar level. Your insulin doses may need adjustment if you engage in vigorous exercise. Now let us go to treatments of type 2 diabetes mellitus. The primary and the first treatment for type 2 diabetes mellitus is dietary and lifestyle modification. Many people have been able to control their sugar level with only this dietary and lifestyle modification, and some were even able to reverse the condition. So you can see how important this is. The dietary and lifestyle modification you should engage in include eating healthy diet, like moderate carbohydrates. If you have type 2 diabetes mellitus, you can take carbohydrates, but in moderation. It should not be too much. If you want to take rice and beans, let the beans be more than rice. You can make it in ratio 2:1, that is beans 2 cups, rice 1 cup. If you want to take swallow like semovita or amala, your bolus meal should not be more than your feast. You calculate it according to your feast and take it with plenty soup. Take whole grains like brown rice, legumes like beans products like bean soup, bean cake, moi moi, and so on. Take high fruits and vegetables, high fibers, high raw veggies. Avoid sugary fruits like pineapple. You can take apple, you can take cucumber, you can take carrot, garden egg, and so on. Also avoid sugary drinks. Ensure you take your meal and snacks at the same time every day. Ensure regular exercise at least 30 minutes every day or 150 minutes every week. Exercise helps to lower blood sugar and prevent unnecessary weight gain. You also try to reduce your weight, especially weight around your tummy, because losing weight improves insulin sensitivity by the cells and tissue and lower blood sugar. It also prevents insulin resistance. Avoid smoking. Closely monitor your blood sugar, your cholesterol level, and your blood pressure to ensure these parameters are in normal range to prevent complications. Now, if after lifestyle modification and dietary modification, your sugar is not still well controlled, then your physician might put you on diabetic medication, that is oral hypoglycemic drugs, or in some advanced type 2 diabetes, they might be put on insulin injection. All these medications have various modes of action. Both the oral and the injection have different ways they act to bring down the blood sugar to normal. Some lowers the sugar produced by the liver, some makes the tissue and cell more sensitive to insulin, some increases insulin production by the pancreas, and some increases the amount of sugar excreted in the urine. The level of your blood sugar will determine the amount of medication you need to take, and this can be checked with a glucometer. Now, what of treatment of gestational diabetes? This gestational diabetes usually goes immediately the person delivers, but during pregnancy, the pregnant woman also can engage in dietary and lifestyle modification to control the blood sugar, and in some cases they might be put on medication to control their blood sugar pending the time they will deliver. If you're on diabetic medication, you're at risk of hypoglycemia, that is the blood sugar becoming too low because of inadequate food or too much medication. So take note of this sign that you might notice when your sugar is too low. Number one is shakiness or trembling, profuse sweating even when the weather is cool and everybody are feeling cold, you feeling heat and you'll be sweating profusely. Hunger, dizziness or lightheadedness, palpitation, anxiety, headache, and pale skin. And when you notice this, quickly check your sugar level and get a glucose tablet or glucose powder or sugar to prevent hypoglycemic coma. If you are diabetic, either type 1 or type 2 or gestational diabetes, there are some special care you need to give to your feet, because in diabetes mellitus, the high blood sugar destroys the blood vessel and disrupts blood circulations to your feet and the extremities, and also destroys the nerves. And because of this impaired blood circulation and destruction of the nerves, you might be having signs like tingling sensation, numbness at your feet, pain, or inability to even feel pain at all. Because of loss of sensation, you might not notice when you have bruises or injury on your feet. And if this wound or injury is left untreated, it can get infected. And because there's reduced blood circulation to that site, it delays the healing of the wound, which can result to amputation. So you can care for your feet by checking your feet every day. You check the skin and the nails, you check it for cuts, for bruises, for redness, for colors, or any abnormality. Also, you should wash your feet with warm soapy water, not hot water, because if the water is too hot, you might not be able to feel it, which can burn your skin and subsequently lead to sore. After you have washed your feet, ensure you completely dry your feet with towel and pay close attention to in between your toes. Ensure you dry them very well. Also, avoid walking barefoot even when you are inside to reduce the risk of prick or injury to your feet. If you have numb feet, you can warm your feet by wearing socks and covering your feet with blanket instead of electric blanket or heating pad, which can burn your skin. Wear socks and comfortable, well-fitted shoes, not too tight shoes, to prevent injury or bruises to your feet. Check inside your shoes before you wear them for pebbles, for sharp objects which can injure your feet. Then you should trim your nails, both fingernails and toenail, with nail cutter and not razor blade. And when you are trimming it, don't let it be too low. After you have trimmed it, you can now use nail file to level it. Also ensure you see your physicians immediately if you notice any abnormality on your feet, either bruise, cut, sore, hard skin, ingrown toes, pain or loss of sensation on your feet, fungal infection like athlete foot, dry cracked skin, or any abnormality. Talk to your physician immediately before it gets complicated. I've come to the end of today's video. Thank you for watching to the end. Trust you've gained something meaningful today. If you have, do also subscribe to my channel, like the video, share with your friend, turn on the notification bell to be the first person to know the next time I upload another new video. See you in my next video.